Okay. It's 6:15. Good afternoon to everyone. With 6 of the 7 board members present, we have a quorum and we can conduct this. And in accordance with Executive Order number 71, which allows governing bodies to meet electronically to conduct business, I'm officially calling the February Health Facility Committee to order. A copy of the proceeding of this night will be available on the health website at www.lchealthsystems.com. Before we begin tonight, John, would you lead us in prayer?
Sure. Kind and gracious Heavenly Father, we're thankful for this day. We're thankful for the blessings that you've given us, Lord. We're thankful for our health system in Lincoln County here. Just be with us this evening. Give us guidance and wisdom to make decisions that is best for our community and in accordance to your will. Just give us all a word of Christ's name we pray. Amen.
Thank you. Appreciate it. The first agenda item is the consent agenda. Are there any items in the consent agenda the board like to be set aside for further discussion? If not, I entertain a motion.
Anthony, hold on one second, Anthony. Donnie has a question, or Donnie has a question about one of the items. Donnie?
Okay.
Anthony, before we approve the consent agenda, I'd like to take the board minutes from the last meeting off of the consent agenda, and I have an item I'd like to discuss either now or later on. It don't matter to me.
Okay. We'll go ahead and approve the consent agenda without the minutes, and then we'll go right back to the minutes to address your question. So entertain a motion to approve the consent agenda minus the minutes for further discussion.
So moved.
Motion made by Dr. Morrison.
Second.
Second by, who was second? David?
It's Dr. Edwards.
Dr. Edwards, how you doing?
Fine,
okay.
thanks.
Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Okay, Donnie, we're going back to the minutes. What in the minutes you want to talk about, bro?
Well, at the last meeting, and I apologize I wasn't here, but we had the motion to close the wellness center to Patrick. Since that meeting, we've had a lot of discussion in the community about that decision. They've asked it, people in the community have asked that we reconsider that, and I talked with Mayor Newman about this. I think he's been sending emails to the Health Facilities Board from some of the people that have expressed concerns about closing the wellness center, and I would like to see us defer the closing of the wellness center until July 1, in order to give opportunity for the community to express their concerns, and also it would be after the budget process and for the county, since the county budget is usually approved by July 1, and it would just, I think, be a better partnership with the community to allow them time to express their concerns and maybe have opportunity for them to be willing to pay more in fees for membership in the wellness center, and also for the county, hopefully would want to contribute some to the health system, to help in maintaining, for instance, the pool or some other portions of it, and hopefully we could get them to help us out a little bit. But I'd like to make a motion, we defer closing until July 1.
I think that's gonna have to be another motion on a new motion. The minutes were reflected and they reflected what occurred for last month. So, I thought maybe you might have an error or something like that, but there's no errors on the minutes. So the minutes should be approved as they were, drafted and in accordance with the meeting that we had. We're also gonna have a executive session after this to discuss that very issue that you're talking about, Donnie.
Okay, that's fine.
Well, I make a motion to approve those minutes that were accurate at that time.
Yes, ma'am. Motion made by Dr. Morrison,
Second, John Thorpe.
second by Commissioner Thorpe. Any other discussion? All those in favor say aye.
Aye.
Opposed say nay. Okay, next is quality report.
I'm gonna pause the mic down just a little bit. Can everybody hear me okay? It's Courtney.
Yes.
Okay. All right. So in your quality report, the first 3 slides are your patient satisfaction. The 4th slide does talk about what we're doing to improve. We do see that we have room for improvement there on the inpatient side. Satisfaction, although we anticipate that to come up with our ER and outpatient going up. Those action items are that directors are now getting a monthly report and reviewing that report with their frontline staff to include comments. We are continuing leader rounding with a focus on the mint on the pillow mentality. So how can we move those 7s and 8s up to 9s and 10s? So in December, only 1 of 22 respondents on the survey gave us less than a 7. 5 of those 22 gave us 7 and 8. So really our focus is how do we move those 7 and 8s up to 9s and 10s. So the majority of our people are giving us 9s and 10s, but we have to figure out how do we move those few others up to 9s and 10s. So that's really our focus, is that everybody gets the men on the pillow or the Chick-fil-A or Disney World mentality every time they come in the building, which is difficult to do 100% of the time, but that is our goal. For patient satisfaction, we know that employee satisfaction does play into your patient satisfaction. So happy employees equal happy patients. So we're focusing on some employee morale, and part of that is through our COSI debriefs and making action items for those. And then in February, the directors gave all of the frontline staff got a little February Valentine bag just as a thank you. Daryl is attending staff meetings that has frontline staff in it and being there so that they know, who he is, and he's listening to their concerns and helping us, keep us accountable for that. And then we're also utilizing our patient safety boards and getting that education up there. ED has PI that is for provider overall rating, which will, as that increases, and that translates to our inpatient side, since the majority of our admissions come through the emergency department. And we will begin also putting those reports into the hospitalist office so that they will have those for review as well and are getting the feedback from what our patients are saying on patient satisfaction. Next slide for falls. You can see there's a year's worth of data there, and we have done a great job decreasing our falls and our falls with injury. In January, we did have 2 inpatient falls. Both of those were related to confusion, and none of those had injuries, so that was a good thing. Next slide for value-based purchasing. We met our goals for all the value-based purchasing measures, which are readmissions, hospital-acquired infections, falls with injuries. Sepsis data is always a couple of months behind because of the way we have to abstract that, but that is an area that we're looking at as well. As far as a regulatory update for the hospital, you can see there's the things that we've been talking about for a while. Just to add one to that, we are in our window for mammography recertification as well, so we do anticipate that they'll be coming for mammography recertification. CMS did put out a notice today that they have again delayed scheduled regulatory surveys due to COVID, so they will only be coming in-house for complaint surveys and delaying any routine surveys that they have. The next slide goes along with the quality plan that was in your consent agenda as a policy. And that's our PI improvement quality, and I'm not going to go over this with you, it's there for your review, but you can see every department in the facility is meeting the CMS requirement, and I'm having one-on-one meetings with those departments to look at their PI and make sure that we're moving forward with all performance improvement projects in these departments. The only other thing I'll add that I realized I didn't have a slide on, and I'm not sure how I decided to leave off COVID for the health center health system, is that we are continuing to do COVID vaccines for employees as well as the public. We had a clinic yesterday and immunized 189 people with their majority of those first doses, and all but maybe 2 or 3 were community members. So that's been a really good PR thing for the community, and we've received a lot of good feedback. So we'll be continuing to do those clinics as long as we're getting vaccine and have people signed up to do that. Any questions on the hospital side? All right. For Donaldson Care Center, you can see there's a list of performance improvements projects there. In talking with Jack and Michelle there's a whole lot of other things they're working on as well, but these are the primary focus areas that you can see there. And they are really punching through this list to make good improvements over there. Regulatory update over there, we are still awaiting our annual state survey. There were no ombudsman visits in January, no abuse visits or complaint visits in January. We did have 3 reportables, but those were all turned in timely and unsubstantiated and closed by the state. Any questions on Donaldson? And then the home health is there for your review from Debbie if you don't have any questions on that. If you do, I can relay those to Debbie for you and get those answers.
It looked like Debbie it was a good report on the home health and hospice. Okay. Any questions for Courtney? If not, entertain a motion to accept the quality board report and the quality board of trustee report as submitted.
So moved.
Second.
All right. Okay. Motion made by Thorpe, made by Commissioner Ogle, and second by Dr. Morrison. Any discussion? All those in favor say aye.
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 Opposed say nay. Okay. Next is senior administrative report.
Hey, this is Carrie Rogers. I'll give you a quick rundown of just what nursing is doing. It shouldn't take me but a second. We are, based on recommendations from the Board of Trustees, we are monitoring a couple of things from our clinical contract evaluations from 2020. One of those is for American Physician Partners, physician satisfaction, and so you'll see there that very first bullet is January of 2021. Physician satisfaction in the ER is 74.03 at a 61% percentile rank, and that was 17 patients in that database. The baseline was at 1 percentile, so they only had to go up. So that's great, and I do want to mention quickly that we did have 2 compliments today called to Tanya on a physician in our ER, and so we feel like we've got a good physician team in the ER. The compliments today were on the same one, and we will be sharing that with APP to hopefully get some buy-in from the rest of them. But you know, when you're good to your patients, that they notice. and they call and tell us. So I was very, very pleased with those 2 calls today. And then for radiology of Huntsville for January, you see the turnaround times that are there. Again, they meet their turnaround times. They are above the 97th percent on stats and above 99% for priority and routine. And so we're meeting what the contract tells us on turnaround time. I'll go back and that third bullet down is just a reminder that we have continue with 12 full-time RN openings in the facility that are critical to us as we move forward with the times of struggling to take care of COVID patients. Our COVID patient, that 5th bullet down, our COVID patient admissions are down, but Courtney and I both expect that we will have another surge in the spring and the summer. And so we are thankful that we've gotten those 2 ventilators and the 2 vapotherms that we've needed to take care of those patients, and we appreciate the board allowing us to get those things.
Okay. Any questions? Okay, if not, finance? The question?
Yeah, I have a question. On our patient satisfaction surveys, do they send out a text to those patients to fill out those surveys, or do they just make?
It varies. For inpatient, it's a mailed survey to their home address, and it has a prepaid envelope. And then for outpatient and ER, it's electronic. It's email for outpatient and ER.
I know Huntsville Hospital, they use a text. They receive a text, and they use Scanning.
Outpatient and ER can get a text as well. Outpatient and ER do text, but inpatient is mailed only, and that actually was mimicked from what Huntsville, because we were with them. That's actually how they advised us to do it. And we have seen an increase in the number of reports that we've gotten back.
Yeah, that's what I was going to ask you. Do you see a success rate higher with text or email versus the mail?
We've gone back and forth. 2 years ago, prior to going to Press Ganey, when we were HealthStream, the numbers struggled getting the amount of surveys back we really wanted back. And then when we followed Huntsville's lead and went to mail, it dropped down. But now we are starting to see an increase, and our numbers over the last 2 quarters have actually climbed as we've as the public begins to get used to a mailed survey. We're starting to get more of those back. There is an additional cost to do electronic on the inpatient side.
Any other questions? If not, we'll go to the finance report.
Thank you, Mr. Chairman. Before you, the first report is the scorecard. I'll just be brief on hitting some of the key drivers to the operations for January. First thing I'll point out, I think we mentioned maybe before that the COVID activity has started to wane in February, and actually the testing that was performed here was down, and of course part of that was due to the fact that now they can test at the Donaldson facility itself with employees. So you'll note that the outpatient visits listed here are actually down from where they had been running the last couple of months, because we've been running 1,800 lab tests in the past couple of months for COVID. The other thing is, again, it's been, January was probably the last month that we've had with the high census attributable to COVID. Again, that volume has been good for the facility, for efficiency of the manpower, et cetera, and reimbursement dollars. So when you have the volume, it cures a lot of issues. And of course, like I said, Medicare is our best payer. So again, the influx was predominantly Medicare patients. So that was a double win situation there. for the financials. Going in the other arenas for a minute, the Donaldson Center, post-COVID, of course, they had the surge in November, and so they're now engaged in that activity of trying to build back the census, gain the traction, if you will, to try and grow back the SNF activity, which again was impacted by the surgical shutdown that we went through in January, as well as the ICF activity just hasn't come back yet. Some of that probably due to the fact that home health now is being seen as another avenue to use, but we expect with some focused attention we can get that volume back. The other arena that I wanted to comment about again was the hospice and home health, both having strong volume months again, and so they're doing well. Patrick continues to suffer a little bit again. I think the couple things there again, the surgical period in January where we had to stop doing the cases, the elective cases impacted some of their activity, as well as I think just the fact that again, the public's reaction, if you will, to go there for their rehab has kind of slowed down. But again, we're taking efforts there to try and improve that. Physician clinics did fine in the month. And as far as how this activity turned into the financials, again, hospital did well with the volume. And the care centers obviously struggled a little bit in the month of January. And so, again, we've got strategic operational meetings going on every week with them, trying to address the two factors that have impacted their financial performance, and that is use of contract labor as well as the volume being down. And I will say, though, that it's encouraging. I believe that they're up about 7 average daily census as of today versus where we had been running. The skilled unit in particular is up. And again, we have a meeting scheduled this Thursday to discuss further efforts to try and grow the business back. So that, in a nutshell, the month ended up, the whole system ended up with a surplus of slightly over $350,000. And that's basically it. I'll entertain questions.
That is really a good month that we actually made $354,000 based on the services that we provide, and not any of forgiveness of a loan, so to speak. So that's just absolutely wonderful. So thanks to everyone.
That's correct.
Yeah. Okay. Any questions for Bob?
Bob, I've got a question. This is Jack. As I'm looking at the financials, Patrick Rehab and Wellness made over $17,000 this month, and for the year to date, they're over $12,000.
Yes, sir.
So we're not losing money. We're just kind of hanging on.
Well, let me clarify, Jack. I think this is one of those things that we've got to be real careful semantically with. When he says Patrick Rehab and Wellness, that's the combination of the rehab with the wellness. The wellness component has lost money.
Well, I understand that, but I'm just saying rehab is carrying the wellness.
That's a true statement.
Yeah, just like the nursing homes have carried the hospital for years. So that's what I'm looking at financially.
Yeah, I'd like to just say, though, that I think we have to be careful there, because I think all entities have a symbiotic relationship when you're part of a system. All entities by themselves are interdependent, okay? And so they all feed each other. So I guess that's the only thing I'd say. But I do think that in the case of the wellness and rehab, yeah, okay.
Yeah, I agree with that. I'm not trying to say one is better than the other. I'm just saying the combination system is doing very well.
Right now, but if the hospital
Right now, yeah.
Yeah, like we have not in the past, the picture is kind of misleading this month.
Yeah, but I'm saying the year to date is positive.
Yeah. Yeah.
Okay, thank you.
Yeah, but, yeah.
Without wellness,
Are there any other?
would have been 27 to 30, right?
Oh, I understand that.
I'm sorry? Yes. Yeah.
Okay. Okay, any other questions? If not, we'll go to the CEO report.
Well, Mr. Chairman, if I could, I just kind of wanted to add a couple quick things from my CFO report itself.
Oh, Tim, I
again-
apologize, I'm sorry.
That's okay. I kind of already alluded to the first comment, so I won't belabor that initiative, but we are meeting weekly, like I said, with Donaldson administrative folks to try and address the use of contract labor as well as to grow the census down there. And we're seeing the fruits of that already. Did want to just quickly mention, too, that for the record, we had talked about filing for the Families First CARES Act dollars that were available to us for the employees that became sick or had to take family leave during due to COVID, and that was filed. And so that was $117,000 that we obtained. And then last but not least, this one we hope to avoid, but as I mentioned, the influx of Medicare inpatient activity is beneficial for us. It's obviously our best payer on an inpatient basis, and we do a good job of managing that from a case management standpoint. The issue we have is we have to be careful, and THA is already on top of it, that when you get a high influx of Medicare, it drops your percentage of 10 care days. And so you have to have a certain threshold to meet in order to get your dish level up there to meet for 340B. And so 340B is currently, if we had to do the numbers today, would be in jeopardy of being lost. But THA is on top of that, trying to get the federal government to give all the hospitals a hold harmless provision and basically say that, hey, you know, they couldn't prevent this from happening. Don't take away the special drug pricing that we get to curb our costs on the outpatient side. So that's $375,000 worth to us on cost savings. So we're actively pursuing that with THA. That's all I had there.
Okay. Any questions for Bob?
Okay, a year, or is it month to month?
Now, it's a full year, so we're 6 months into that reporting year. Yeah, and I don't see it really changing unless Medicare really dropped out. And as you know, OB being a significant contributor to the 10 care percentage, but when you get most of your regular medical type of folks being Medicare, it really skews it. We're down, I think, to like 28% for the combined factor that they get, and we need to be about 38%. It's huge. But they recognize that, and I think they'll work with us on it. I don't think they want to hurt.
I also think March we're going to have an influx of 10 care deliveries.
Okay. Well, thank you.
Yep.
We got 30 of them, dude.
Okay.
Any other questions? If not, Daryl?
Okay. On my CEO report, under the growth pillar, got a lot of services that we're looking at. We're looking, continue to look at wound care, and Bob and Carrie have been working with that, with the financial people, not only here, but with Hologics, and so we ought to be able to wrap that up and have something maybe in the March to talk further about with the board. Bob and I had an interview with a orthopedic surgeon scheduled, but at the last minute found out that he received another contract from another hospital, so we did not have that call. We're looking at telemed coverage, and so we have critical care and cardiology coverage that we're looking at. And cardiology is moving along a little bit quicker than the critical care, and we hope to have that finalized within 60 days and have some coverage here for our physicians in cardiology, which will result in hopefully keeping more cardiac patients here in the facility. Our growth team that we have here at the hospital, which is made up of the various departments, this past meeting we concentrated on our home health and hospice referrals, as well as our sleep study and sleep study procedures. So kind of looked at those to see where our major referrals were coming from in those areas. And then as Bob spoke about, we've been having our Donaldson Care Center operational reviews weekly, and those have been very, very good. People, Russ and I continue to meet weekly. Also, at the end of January, Anthony and I met with Mayor Newman regarding the Wellness Center and the decision that was made at our last board meeting. I then met with the employees April 1st and relayed that information to the employees of the Wellness Center. And then also under people, you can read, there's a lot of bullet points where I've been meeting with one-on-one with meetings with department directors, been rounding with the employees throughout the system at the various locations. I've attended medical staff meetings, specifically OB and pediatric meeting and the general medical staff meeting that we had. So a lot of rounding, a lot of meeting with people and out and about. And then one thing on the upcoming events and marketing, Bob and I and Wendy have had a meeting yesterday with Digital One, which is a employee benefit proposal that we're receiving from the Digital One. And then also we have a scheduled meeting in the next week to 10 days with Gallagher, who's our current provider of benefits, and kind of just start the process of reviewing the benefits so that we can lay out a presentation for the board as far as our benefit proposals for our employees for the new year. So a lot of activity going on within the hospital and within the health system. And with that, Mr. Chairman, that's my report. I'll be glad to entertain or answer any questions.
The cardiologist, the telecardiologist that you're talking about, didn't we engage with a cardiologist out of Huntsville? Is that process working well or what?
Well, the telecardiology that we're speaking of is with TriStar out of Nashville. It's a lot easier. We have the neurology coverage with them now, and so we use the same robot. We will use the same robot with cardiology that we do with the neurology. So we're in the process of having implementation meetings, and they're working on sending us information so we can credential their cardiologists for our medical staff.
Right. And Mr. Chairman, when you made a reference to Huntsville, I'm assuming you might have meant also that we have one of their cardiologists here on site 2 half days, and Dr. Cox is doing exceptionally well here and making rounds and consults in the hospital while he's here.
Okay.
So yes, that is going very well.
Okay. All right. Tell us, Daryl, about the town hall meetings at the Donaldson. How's it going?
Okay, we've had those are going well. We've had 3 meetings. Had one this afternoon. I've got one tomorrow and a couple later this week. But those are going real well. This is kind of in response to the letter that we received that I sent you a copy of. Basically, what we heard is that we're also reviewing the survey, the COSI survey, but what we've heard is that since we've had a change in leadership in the nursing area out there, there has been a big turnaround as far as the staff is feeling more comfortable with Michelle. They are seeing Michelle out on the floor more. The administrative team out there has moved their offices to the middle of the care center, so they're now down hallway 4, and are more visible to the staff. They're receiving more training. They're receiving more training from Michelle and the other nursing staff out there. There's more of a teamwork approach now that they're saying, they're telling us about. So that's what I've gathered in the first 3 meetings I've had with the staff out there. And like I said, I'll continue to have some meetings this week. I think we have 3 more meetings this week.
Okay. All right. Any other questions for Daryl?
This is Dr. Edwards. I just got a quick question for Daryl. Daryl, I think some of the physicians have heard that maybe at the end of this year, Dr. Crump may be retiring. Is that true? And if so, should we go ahead and start searching for another general surgeon?
I have not heard that about Dr. Crump. Now, Dr. Beasley has told us at the end of the year that he was looking at retiring, but not Dr. Crump.
No, Dr. Crump just had his contract renewed for another year.
Yeah.
Okay, so Dr. Crump will probably be staying then.
Yes, sir. Yeah,
Okay.
Like Bob said, he just renewed his contract. Just renewed.
Oh, great. Okay, good deal. That's good because that was the kind of the rumor going around. I don't know where it started. It may have been associated with Dr. Beasley leaving. So that's good news.
Yes, sir. That is good news. Okay. Thank you for bringing that to our attention.
Uh-huh.
Any other questions? If not, entertain a motion to accept the senior leadership report as submitted and briefed.
Move we approve.
Okay. Motion by Commissioner Thornton, second by Commissioner Sanders.
Oh, this Edwards.
Hey, Dr. Edwards, okay. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed, say nay. Okay. Next is the risk management evaluation presentation.
Yes, Anthony, you wanted me to just review with the Board of Trustees the risk management plan, and so I'm just going to give an overview. The first document there is just a PowerPoint presentation that I'll run through. The second one is the actual 2 documents that go into our paperwork here at the hospital. One is an evaluation, and the other one is our annual plan. And I'll just remind the Board of Trustees that every year to 2 years, depending upon the item, every plan must be reviewed for its effectiveness and obviously updated if need be. And examples of that are the quality plan, risk management plan, environment of care, emergency management, utilities, security, safety. All of those plans have to be reviewed. And so CMS just changed the requirement on the emergency management side. Those particular plans only have to be updated every 2 years, but the clinical plans like Courtney's Quality and My Risk have to be done annually. So that's why we do this. And so one of the things that's in the risk management plan is it just talks about what are the things that the risk management does. And so the first slide just gives you examples of things that risk management does on a daily basis. Claims management, event investigation, root cause analysis, failure mode and effects analysis, analyzing risk issues, working on loss prevention and risk avoidance activities. I wanted to give you a couple of examples of loss prevention. That would be ensuring that we have proper liability insurance for all items that is needed. Ethics and compliance training is a good example of loss prevention. And then risk avoidance activities. That would be if we found we had an error, then we would put performance improvement activities around the error to make sure that the error doesn't happen again. Other things that we do, obviously, are just investigation, collection of data. Examples of that would be, or incident reporting, examples of that would just be security issues. I get a security note almost every day of, a patient that's causing a ruckus in the ER and might have slapped somebody or yanked somebody's hair or whatever. Falls on the ice last week. We had, pretty dangerous terrain around here last week. We actually had a visitor fall all the way down the steps over here. I believe it was a Dr. Klein patient. Those are types of things that I go into and investigate every day. Other things that we do on a daily basis is compliance activities, such as conflicts of interest, grievances, HIPAA violations. I'm currently today investigating a potential HIPAA violation. And then, of course, the culture of safety oversight and patient safety. So those are just general activities that have to occur on a daily basis with risk management. The next slide just tells you that we break it down into 6 different categories for risk reduction: patient, medical staff, employee, property, financial, and other. And then those 6 categories are broken down on the next page of things that I have evaluated from 2020. An example of that we participated in and had benefit from in 2020 on patient risk activities. An example of that was we had a pretty significant medication error in the nursery, and we took a great pains to ensure that we do not ever have that error again, and we went through a root cause analysis, and then the team, which consisted of pharmacy, nursing, respiratory therapy, the physicians, all worked on the way that we could prevent that error again. So that's an example of a patient risk reduction activity that we did in 2020. Medical staff risk activities, we went through the medication reconciliation process to make sure that those were correct and error-free. Court updated our peer review process to ensure that it was fair and the appropriate way to do that. Another example is we terminated the mid-level management of ventilators because they weren't credentialed or privileged to do that. So again, that's just risk avoidance activities or risk improvement activities from medical staff. For employee risk reduction activities, obviously it's been a very important year on staff education and infectious disease prevention. COVID in the beginning, people were very frightened, scared, didn't know how contagious it was, and we ad nauseum from February the 15th, literally for 11 months, have educated staff on infectious disease prevention activities. Let's see, some other things that we did in 2020 for employee risk is we did eliminate day shift security, and so we've been very astute to monitor all of the security issues that have occurred on day shift, and we actually adjusted the hours of the security officer just recently, I would say within the last 45 days, where we asked the security officer to work 3 to 3, 3 p.m. to 3 a.m. to better suit the hospital and the needs of the nurse and staff, especially in the emergency room. Financial risk reduction activities, that last column, obviously those types of things that we manage are the claims management, and that would be any lawsuits or pending lawsuits that are happening and how we manage those with our partner, which is Mag Mutual. Another activity that we did in 2020 was we completed the sale of the Lincoln Care Center and completely cleaned out that building. And cleaning out that building and relieving ourselves of that risk, it prevents us from having any liability of personal injury. You remember that we had continual break-ins over there, people trying to get in through the windows, breaking the glass windows, and so that presented a liability to the hospital, and so getting rid of that building prevents us from getting any financial risk there. Also, the building was full of medical records, and so we prevented any HIPAA breaches by getting rid of everything in the building and cleaning it out. So that's just an example of the things we did in 2020. Other things that we did, if you'll go on to the next slide, this just gets down to some specifics. We had an example of 3 HIPAA violations in 2020. All 3 were level 2, and those employees were counseled, and we've had those employees have not had any more. We did have a near miss on an EMTALA violation with Pulaski Hospital, and the CEOs of both hospitals handled that without any issue. We had no patient reporting to the QIO. We have currently 3 existing EEOC complaints that are in process. And also this year, we did do a Board of Trustees annual self-assessment, and that is a risk reduction process in itself, and we appreciate the board completing that process for us back in December of 2020. If you go to the next slide. I want to mention here, this is sort of really the important slide for me, and this is that these are things that are ongoing that we have to continue to do in 2021. And we are actively debriefing our culture of safety and engagement survey with our staff. I'm very excited because we've gotten really good feedback this time. You know, we did this survey in 2018, and we just did not have good follow-up from it, and so we committed. Daryl was very insistent from the get-go that we be committed to the follow-up, and we've tried to do what he's asked us to do in that we have started the COSI debriefings immediately, and we've gotten great feedback already. So I'm excited to get you guys those results. And we hope to have you a report in March of the COSI survey responses and some of the follow-up that we've gotten. Hope that's okay with you guys. That number 2 there is an issue for me, and I'm hopefully we can increase our risk management activities at Donaldson Care Center. We we just do not have a good risk reduction plan for Donaldson. Part of that is my fault, but it's just a lot of competing priorities, and that one gets on the back burner. So we need to have a very active risk reduction program at Donaldson, and we will be working on that. Other things that we'll be working on are the things that need to happen, such as a video monitoring system in the hospital that's more robust so that we can look at video footage clearly and get the information that we need, especially on the outside of the building. So we'll be working on that with Bill Denny to make sure that happens. And one thing that would really mature our hospital and mature our patient safety program is to actually name a patient safety officer. And so I'll encourage that for 2021 as well. And then finally, 2020 claims update. We do have one open case at the hospital that is in the discovery phase, and we have one record request for Donaldson. We've had 2 cases dismissed. One was prejudice, and one didn't even make it, I don't reckon, well, it did, but both have been dismissed at the courthouse, so we're proud of that. And that is my summary for you. I hope that was enough information to get you what you needed for just risk reduction management activities. Again, that second and third document there are just the 2 official documents, and I will need an approval of those for 2021.
Okay. Can I ask you a question?
Yes, sir.
November or December, we submitted, the county commission approved the sole EMS provider resolution. Wouldn't that go on the financial risk since we prohibit any competitors from coming into Lincoln County?
Yes, sir. It sure would, and I will put that in here as an addition.
Okay. All right. And you need approval for the risk management plan for 2021?
And evaluation of 2020, yes.
Okay, all right. And where's the 2021 evaluation plan? I see everything is 2020. It's the last bullet. You say in 2021, right?
Correct.
Okay. And is this calendar year or a government fiscal year?
It's a calendar year.
Okay, I got you. I guess the heading got me thrown off at risk management 2020. That's fine. Okay. Entertain a motion to approve the risk management evaluation for 2020 and the 2021 plan for risk management.
I'll make a motion. It's Edwards.
Okay, Dr. Edwards made the motion. Second by who?
Donnie made it.
Donnie? Okay. A motion made, properly second. Any discussion? All those in favor say aye.
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 Opposed say nay. Okay. Okay. Are you still on? Is that it?
We're here.
Oh, okay. Yeah, I see. Okay. All right. Anything else?
Chief of Staff report.
Okay. All right. Okay. I'm where are we?
Chief of Staff.
Chief of Staff, Dr. Klein.
Okay. All right. It's Dr.
B
Klein.
under number 3.
Okay. It's Dr. Klein.
Yeah, I'm here.
Okay. How you
Am
doing?
I loud enough?
Yes, sir.
I'm doing well. Want to talk about our COVID vaccine program. I've got some concerns, and I want to bring them to the board. We already talked to Daryl about it, and I think we're doing our patients a disservice by not giving them all the information. So what I've got here is a handout of what we give from the Tennessee Health Department and some additional information that I wrote up. According to the Tennessee Health Department, and this is the one that we give all of our patients, the chance of anything bad happening is less than 0.01%. And according to the Tennessee Department of Health, they will be receiving the vaccines in mid-December. So this number of 0.001 is done a long time before the vaccine was even started. So this safety information data is all flawed. I have in front of me all 653 case reports from the vaccine adverse reaction reporting system of the deaths from the corona vaccine from Moderna and Pfizer, most of which have been acute pulmonary reactions happening anywhere from within an hour to 15 days later, like Hank Aaron. And I think our patients need to be aware that the safety reporting that's on these sheets is not turning out to be what was anticipated. In January 29th, the safety data said that there was 4.15% deaths from that. 2 weeks later, week and a half later, on February 4th, that number is increased to 5.15%. Okay, so if you've got 1 foot in the grave and you're over 70, the chance of dying from the coronavirus is 3%. With the H1N1 vaccine, when they reached 25 deaths total, they pulled that vaccine from the market. RNA vaccines by themselves are inherently flawed. All RNA vaccines have never come to the public because what happens is they have what's called pathogenic priming. That means that you take the vaccine, and when you see the virus, your body responds twice as hard. So you get sick faster and you get more sick. So they all stopped at the animal studies and they usually use ferrets because their immune system is similar to ours because so many of the ferrets were dying. This vaccine has both short-term, which what we've got here with the death reports, and long-term concerns because right now we're getting the immediate reaction. 6 months from now, when we start getting some COVID, that's when we're going to have the pathogenic priming. Okay, they talk about this vaccine, and it's not a vaccine. It's technically an experimental gene therapy because they use messenger RNA, and they don't make any antibodies, which is what they say here. They're making antibodies. How does it work? We're going to make antibodies to the corona spike protein. Well, the corona spike protein is actually put in the cell, so it's not attached to the cell wall. So if they're making antibodies to that spike protein, it's just as likely to attack the human body, creating all these immune problems such as MS, lupus, sarcoidosis, and including when the coronavirus shows up, it's likely not to recognize the coronavirus because it has something that humans have on it, and it won't know what to do with it. So these are just a few of my concerns here, and what I would recommend is that this report that I've written up, it's got about 6 pages on it, be put down there with the other stuff from the Tennessee Health so that the patients are able to see a more rounded picture of what the possibilities.
Okay. All right, thank you for the information. Any other report to give? Okay. Now we'll go to the Donaldson Care Report. Carol, you going to do that, or are you going to submit it as is?
Yeah, I'm sorry. I'm going to submit it as is for the Donaldson.
Okay. All right. Okay. Entertain a motion to accept the report as submitted.
I make it.
Okay, that's Jack, isn't it? Or is that David or Jack?
David.
Okay, David. Thank you, Commissioner Sanders. Who seconded? Need a second.
Ogle seconded.
Donnie.
Okay. Okay, motion made, properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Okay, thank you. Next is Patrick Rehab Wellness Report.
On the
Darryl, is this going to be?
Patrick and EMS, yeah, I approve as submitted, please, sir.
Okay. Okay. The Patrick Rehab Report and the EMS report has been recommended to be approved as submitted. Need a motion?
We approve.
Okay. Who was that motion made by?
Thorpe.
Okay. Commissioner Thorpe. Okay. Who second?
Second, David.
Second, Commissioner Sanders. Any discussion? All those in favor say aye. Opposed, say nay. Okay, thank you. Any new business, Darryl? Bob?
I would like to, at the proper time, go into an executive session, please.
Okay. Okay. Any other new business other than that?
No, sir, that's all.
Okay. What about the capital purchase is just information?
That's correct, Mr. Chairman. There are no requests requiring board approval.
Okay. All right. Well, we're gonna go in executive session, so we're going to executive session now. So, and now we're in regular session. Do we have any action items that we need to approve? Other
We have
than
to talk about going to the
the
board.
90,
Do we have to talk about the course of action going to the county budget people?
yeah, right, yeah. I entertain a motion that Darryl sends a letter to Steve Graham, CC us, telling him what the monthly subsidy at this time would be at $92.71 per month.
Hey,
make that
Anthony, shouldn't that be sent? Shouldn't that be
Sir?
sent to Bill Newman and let him send it to all the budget committee members?
I defer to you. Whatever you think. I know I talked to Steve, or Steve was the chairman, and told him we would send it to him.
Well, that's good, but if Bill sends it out, everybody will get, every budget committee member will get it.
And shouldn't that also include the physical plant issues, at least in summary?
We don't know what that number will be.
No, but the things that we do know we can put on there.
And it might be a good opportunity to engage Ricky Bryant and have him being the advocate and a partner if he thinks he could get things cheaper.
That's what I'm saying.
Yeah.
Work collaboratively, yeah.
Yeah. You know, maybe Darrell, you could put in there, we would like to engage Ricky, solicit Ricky Bryant's assistant to see what he could, some of the recommendations on our physical plant requirements.
I think that's a good idea.
That'd make his head swell up pretty big, though.
Yeah.
He's on the budget committee, ain't he?
Yeah.
Yeah, that's what I'm thinking.
Yeah.
Agrees the wheel.
Yeah. Yeah. Okay, a motion has been made. Did I hear a second?
Second, David.
Second by David. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Okay. Darrell, you get that out tomorrow? And
Yes, sir.
and Donnie,
Yep.
when he sent it to Steve, should you say send it to everybody on the budget committee and Bill Newman, or what?
I was saying send it to Bill Newman and let him send it to the budget committee. Ordinarily, we do that with Cole Bradford, but he's not there.
Yeah. Well, I had told Steve we would send it to him, and we could see.
Well, you can do it both ways.
We can see Bill.
You can do it both ways.
Okay.
Yeah, you can see Bill Newman so he can.
Yeah, we can CC Bill Newman. Okay.
That'd be good.
Okay. Okay, Darrell, is that it?
Good. That's it for me.
Any other business to bring up?
Move we adjourn.
Okay. Motion. Who's that make that motion? Motion made by Thorpe, second by. Any discussion? Okay. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Okay, no opposed. The meeting is officially over at 7:04. Thank you all. Stay safe. All right. Take care.